welcome to Two Doulas and a Midwife. I'm Lisa Houghton. I'm your co-host along with Danielle and Sharon. Danielle's a doula and Sharon a midwife. And together we're hoping to bring you all the wonderful, incredible things you're going to experience along your journey with pregnancy and birth. And hopefully we'll be there with you every step of the way. We're going to be talking today about why choose a midwife, why choose a doula, and I think they are very important subjects to talk about because people don't realize how important having a midwife and a doula can be to your journey. I'm going to introduce you to my co-hosts now. I've got Danielle, who's a doula, and Sharon, who's a midwife. They're going to introduce themselves, and then we can get on to this exciting subject. Danielle.
Thanks so much, Lisa, and always so wonderful to be with you and Sharon. We always have such wonderful conversations. We can talk about pregnancy and birth for eons. So I am Danielle Kavanagh. I am a birth doula practicing in the Johannesburg area. I qualified through Mama Bamba. That's an organization started by Robin Sheldon, who is an amazing midwife, doula, and unborn child communicator. She is quite an amazing human being. And what brought me to this journey was wanting to get back into the birthing room after having such wonderful birthing experiences of my own. I had 4 absolutely beautiful births, all 4 with midwives, with a team of midwives. And I was very fortunate to be given the opportunity to have absolutely magical birthing experiences. And yes, birth comes with pain and it comes with its hurdles and its struggles, but it can also be sublime and absolutely out of this world. And I reached a point in my life where I realized that I wanted to give that back to other women after seeing so many women have their births almost taken away from them and their choices taken away from them, and not realizing that they can have a say in their birth story and their journeys. And for me, being a doula is about carrying women through that journey, informing them of all those amazing choices that they have, exploring their options, and, allowing them to understand that this is not the doctor's birth or, their care provider's birth. This is their birth, and just giving birth back to the mother. And it is my absolute joy to just be affiliated with people like Lisa and Sharon, who are like-minded, and to have these wonderful conversations. And we learn so much every time we get together, and we all have an absolute passion for learning and growing. And that's one of the things, especially Lisa and I, having done this doula journey together, we are constantly on this search for learning more and understanding more about women in birth so that we can give women the most wonderful experiences that they can possibly have. Families, the most wonderful experiences they can have. The birth belongs to the families. And I personally was excited about birth from a very young age, and my brothers were born when I was a teenager. I went through my mother's pregnancies with her, attended ultrasounds, and when their babies were born, I bathed them and fed them and changed nappies and did everything. I always say they are my first babies, my brothers. And I feel everything in my life has led me to this point. And I'm just very excited to share what I have learned and to impart this knowledge to these lovely mommies that may come across our conversation. And with that, I'll hand over to Sharon, our amazing, knowledgeable, experienced midwife.
Okay. Thank you, Danielle. So I, in fact, did my general training here in South Africa, and I went back to the UK to study as a midwife because the difference in the training there was so enormous, in that I saw myself as the community midwife with the cape and the cross your heart and the cap and the basket on the bike and whizzing down hills and rushing to mums in labor. And that's what I got. And so sometime later, we returned to South Africa, and I have set up an independent practice here. And the most common question that I get asked is, what is the difference between a midwife and a doula and an obstetrician and a gynae? And so if I might cover that first. And what I'd like to say, in actual fact, is that every single independent midwife works differently with her doula. Some midwives work only with one doula. Some midwives don't work with the doula and just expect the mum or the family to find their own doula. And every doula, like every midwife, is offering something entirely different. And that's why it's so important, I think, that each family puts the pieces of their jigsaw together so that they can see their picture clearly as to what their needs might be. So if we look at what is an obstetrician is a specialist doctor specializing in the diseases of pregnancy. And so very often, if you don't have a disease, and most women don't have a disease when they're pregnant, they are just pregnant. So if you don't have a disease, then you don't have very much to talk to your doctor about. And again, if we look at the research, what women have asked for, what women state they want most of, is time for questions, time for discussion. And if you see what an obstetrician is, they are a scientist who is looking for complication, for trouble. And if you don't have trouble ahead, then it's thanks for coming and we'll see you next time. If we look at the European model of childcare, of pregnant care, it is usually in the hands of the midwife, for that very reason, and I'll explain in a minute. If we look at what a gynecologist is, a gynae is a doctor who's specializing in the diseases of the female gynecological tract, of the female reproductive system. And so if you are needing pap smears, if you're needing, if you have polycystic ovaries, or you have some sort of gynecological problem, then you are seeing your gynae. In South Africa, though, gynecologists and obstetricians very often are the same person. They merge their work and they offer both situations. A midwife is a specialist in she's a medically trained specialist in healthy pregnancy. So she is the educator. She is the one who is going to talk to you about feeling tired in the first 12 weeks, about what bloods to have done, about your general health, about your diet, about exercise in pregnancy, about soft cheeses and all the other exciting things that women get perturbed about when they are pregnant. And so she is there ideally to give time for discussion, to look at the emotional side of pregnancy as well as the physical side of pregnancy. She's there to guide the family, as I see it, through the pregnant journey, because change is coming. Change isn't just coming to the mother. And I like to, with my mum, really pound on about the role of the dad. So to me, it's a changing situation for every member of the family. And I feel that when we look at what a psychologist says about the problem with the world today, it is the absent father. And so often we talk about the mum's role in the pregnancy and in birthing her baby. And of course, that's extremely important. But the father today, I think, needs to be held up more.
Mhm.
In order that we can have strong families moving ahead. If we're going to have partners, then we want to have partners and partnership with every major event in our lives. And this is one of the biggest major events in anybody's life, is giving birth to a child and expanding the
Absolutely.
family. And so that's why I work in a unique way with my doula, that I'm focusing on the father's role producing oxytocin. And so yeah, I know that you're going to talk about, everybody doula role the way that it should be. But I just want to say that, every midwife is working differently with the doula. And I think that's why it's so exciting in South Africa. I don't know if women know that they have more access to choice regarding
Mm.
childbirth in South Africa than anywhere else in the world. That it's only in South Africa that you, as Mrs. Jones, can walk into um, an obstetrician's office without a referral and make an appointment to see him. So it's fabulous that you can
No,
have your
we're very
baby
blessed.
in a
Mm.
government institution, or you can have your baby in a midwifery institution. You can have your baby at home. You have the right to have your baby wherever you are comfortable. And as we all know, that's the most important aspect of creating the environment in which a woman is going to give birth. I'll leave
So now,
you to what
Sharon,
you. Yeah.
sorry. So
Yes.
when would a woman make that choice? So she's found out she's pregnant, she's all excited, her friends have all gone to a certain obstetrician, and she wants to now look further than that. How do you make that choice whether to go to an obstetrician or a midwife?
You see, that's such an interesting question, because if we look at the South African history, women have been suppressed for a long time. And so they're not encouraged to ask questions of
Mm.
professional. They are told that they don't know as much as the doctor might know. And so that's how that very woman that you are describing, her peers say to her, go and see this doctor. But she doesn't ask questions like, what is your cesarean section rate? What are my chances of having a vaginal birth? Can I take a mat off the
Absolutely.
bed and put it on the floor here? Can I get on my hands and knees when I'm giving birth? Are you going to want me to have an epidural in my labor? What are my options? What are my choices when I'm looking at pain relief in your hospital? When will you come to me when I'm in labor? Is it only when I'm pushing the baby out? Are you going to be sitting at the bed beside me when I'm in labor? Because women think that. They think
Mm.
that, there's a doctor and the doctor's going to sit there beside the bed while they are in the first stage of labor. And so they don't know what questions to ask. And I think that's
Mm.
why we are here today, to guide women through. Stand
Definitely.
up, have a voice, and ask your questions. So the
Mm.
way that I do it is I offer a free consultation anytime in the pregnancy. I like to have it before 12 weeks, or even preconception, so that we can get together and she can ask questions and we can talk deeply and
That's
expansive
fantastic. Because
about next.
I think those are
Mm.
phenomenal questions. I mean, you don't think of that. You're just excited about the baby, and you don't think about who's actually going to be by my side. Is the doctor going to be sitting there holding my hand, or is he so busy with these other patients that he's not going to be able to be with me? And so the nurses are there acting in his role.
Many women have never heard of a doula, so they don't know that is a choice also. And I like, if they're having a baby in a private hospital, I would really just encourage them to find a doula to go with them, because then they're not encouraged to be flamboyant. If you look at the running of a labor, she needs hormones, and so she needs to be relaxed. And so we are used to looking at all the ways to help a woman to relax. But if you imagine any sort of average labor ward, it's interesting how it's not encouraged for women to just walk into their hospital, their clinic of choice, and ask to see the labor ward. You have to make an appointment. They have tours available when it is convenient for them. Usually at times in the day, at 2:00 in the afternoon, when the average woman is working, not 7:00 at night for, come with your husband and let's show you the labor ward. And why do we not have these labor wards open for women to go and see? And of course, the basic answer is because it's a scary place. And how can you get relaxed in such an environment? Just look at the bed. Why are the beds always pointed towards the door? It's a huge door. Anybody can walk in. It's not a private place. They don't even have a curtain around the bed. The bed points towards the door. The door opens whenever it feels like, and you've got your knickers off, and you're in a compromised position.
And what a lot of women don't realize is they rush off to the hospital at that first sign of labor, and they land up having these long, exhausting, unproductive labors, because the minute they walk through those doors, regardless of how lovely the labor ward may be, as soon as they enter that more medical hospital environment, their bodies are already starting to go into a more stressful mode, as opposed to that beautiful, relaxed, excited mode that we want women to be in.
So then, Danielle, where does the doula fit in?
Can I just jump in? Because, when you're looking at, so how quickly does that happen? How quickly do we produce adrenaline? If you just walk into the dentist surgery and you smell the dentist place of work, that's adrenaline. You walk into a hospital and disinfectant, and that's adrenaline. And so immediately your blood starts pumping to your legs so that you can run away from such a situation.
Exactly.
And it is taken away from the uterus. It is no longer pumping to the uterus. And how many women have been told that as soon as they thought they were in labor, they were having contractions? My mother was one of them, with her 7th baby. Every time she went into the hospital, she'd had the others at home, and she was forced to have the last one in the hospital because she was a grand multip. And so walking into the hospital, every time she started labor, she'd go into the hospital and she'd be told, oh dear, don't you know what labor is with your 7th baby? I mean, surely you should know by now what the signs of labor are, because it would just go off, because she would get so tense, the blood would pump in the wrong direction, contractions would stop, and then we blame women instead of looking at the environment.
Yes. So then this is where the doula is such an important role, or the midwife, because the mom can then phone the doula or the midwife and actually get that relaxing talk and that understanding of what is happening to my body right now and how can I stay calm even if I have to go to the hospital. And so, Danielle, you can expand on that a bit about the doula's role in that calming of the mom when she goes into labor.
So ideally, Lisa, we should all have a Sharon as a midwife, because Sharon will literally hold the couple's hand from that first consultation right up until the last postpartum consultation that she has with them after the baby's born. And generally, those couples are the ones who have the most successful births, the births that they were hoping for, because they have been so supported over the course of their pregnancies. And so, unfortunately, in today's society, not everyone may have access to a midwife like Sharon. And there are moms who are birthing in hospitals, there are moms who go with a gynae, or there are moms who do birth with midwives, but the midwives may have other tasks to do in the hospital that they work in. So they're not able to sit at their bedside, as we say. And, you know, that gynecologist may have an emergency cesarean while you're in labor. He may have
For sure.
a list of 10 patients that he's waiting to see. If you're going to labor at 8 o'clock in the morning, he has a full waiting room. So our role as a doula is to be that constant support, hopefully through your pregnancy. And if we've only just met you in the hospital, then we go through your entire labor, birth, and postpartum process with you. And there are so many studies that have found that just the constant presence of someone who is not a doctor, who is not a nurse, who is not a spouse, who is not a family member, who is an impartial party, who has the needs of the mother at first priority, but also has that connection, that bridge between the families and their medical practitioners, that those moms are also much more likely to have successful labors and births, the outcomes of the births that they were hoping for. Because our role as a doula is to provide constant support. There are even studies that if a mom had been with a doula for several hours, and that doula, for whatever reason, has to leave the room, even if they leave the room for 5 minutes, it can take half an hour for that mom to get back into her groove. And, it's just amazing to see, how having that calm presence in the room can affect couples and the way that they labor and birth their babies.
The research again shows us that it's not only when the doula leaves that is a disturbance, but every time the door opens. So we know that every time a woman is disturbed in her labor, she can add an hour on to the process, because it takes her an hour to get back to the hormonal level that she was at before that disturbance took place. So even if you're in a regular labor ward and somebody opens the door to say to the midwife in there that it's time for tea, or do you have any towels? I'm looking for towels, or whatever it might be, and that woman's state is disturbed, then we add on time to the labor. We make labor dysfunctional just by putting a woman in the environment that is convenient to us. And also, if we were to defend the obstetrician, of course, nobody would expect an obstetrician to sit at her side while she's in labor, because his job is dealing with patients. So if we were to respect the role of the obstetrician, we would only be calling them because surgery is required. A cesarean section is needed. And so he would have so much more time on his hands if he were dealing with complicated women, with ill women, and with complicated labor.
I have a story, a friend of mine who had successfully vaginally birthed 4 children with a midwife, decided that for her 5th, because it puts her at a little bit more high risk, she's going to go with a gynecologist for that pregnancy and that birth. and the gynecologist landed up delivering the placenta because her body knew what to do. And her labor was progressing, even though she was in a hospital. She had so much trust in her own body and in the process that, the gynecologist didn't even believe her when she said, "Believe me, my labor will be quick. You should come soon." And and within almost minutes, that baby was born. And and the obstetric nurse that was looking after her delivered the baby. It almost seems like crazy at the thought that the doctor literally walks in to catch the baby. When naturally a woman could catch her own baby. Or
but I think that you shouldn't ever tell a woman that she can't do. How many times do we hear stories of, well, the midwife said I was 2 centimeters and I had ages to go, and half an hour later the baby's born. I think we should never tell a woman that she's not in labor or that she's ages to go, because she'll just prove us wrong every time.
Absolutely. And nature, your body knows what to do. The baby knows what to do. It's instinctive. It's not premeditated. You don't think, okay, today I'm going to do this and this and this. When it's ready, it's ready. And your body goes into complete autopilot. You don't actually have to be there.
Doulas also, we try and keep the mom connected with her baby. When we're in that pain, when we've all been through it, we all know what that pain is like. You tend to forget what's actually happening and what the end result
greater purpose.
And that the baby actually plays a role in that labor process. It's not a passive passenger, as it were. That the baby's actually working just as hard as the mom through that process, and
feeling the contractions more.
Exactly.
We also need to think about that baby's journey, not only the trigger of the labor, but this is no picnic for the baby. It's not like they're just waiting for you to want to push them out. They're getting crushed by the contractions. So if she could breathe for the baby while she's having contractions, be the oxygen supply for the baby, then her body is going to be softer, her body is going to be less resistant, her baby is going to travel more easily into her arms and arrive quicker.
Often people say, well, I have a wonderful husband, he'll be a great partner. Now, I'm birthing in a hospital. Why do I need someone else in the room? Why do I need a very
great
involved
question.
wife or a doula? And and Sharon, as you were saying, sometimes these moms need someone to remind them, breathe for your baby, relax your shoulders, have a drink, have something to eat.
We can't expect dads to do that because they are there in as much, I don't want to say fear, but they're anxious as well for their wives, for the mother of their child. Is this baby going to be okay? Is mom going to be okay? They're not stopping to think about, with every breath, do you need to hydrate?
Having said that, of course, we have a role to prepare the dad. And I have a dad class, which is only preparing the dad. So what is his role? How do we empower him? Look at empowering the dad. And if he is satisfied knowing what his role is, only he can produce oxytocin in that woman. And we're either providing oxytocin naturally, or we're very keen to give it artificially. And if he is encouraging her to produce it naturally, it is a pleasure for her. It is enjoyable for her. The only way she's going to have an orgasmic birth is with him, not in a bottle syntocinon that we use, the pitocin that we use, is convenient for the running of a labor ward. But the pain that results from it, we're far more likely to have maternal distress, fetal distress, because of what we're going to hurry her up with. Whereas if we can get them to produce oxytocin together, then along with that, she's producing endorphins, and that's her pain relief. People don't tell you that the stuff that you can produce for pain relief from your body is far more powerful and more effective than any drug I can give you. But we have to have her in the right environment and with the right people so that she has that opportunity to do those things, to produce the goodies.
And Lisa, you have the amazing opportunity to see this in motion because, working in a natural birthing center, you have these moms who have labored at home in the comfort of their homes, in their environments where they're with their husbands, and then they march into these beautiful birthing rooms where
I'm very blessed with that, Danielle.
created, and they're at 10 centimeters, and then they birth these babies.
And very often it's very quick labors because they've been given the support to labor at home. And so by the time they come in, they're in that good space already. And they come into a place which is like a second home. So it's just coming into a bedroom situation where it's calm, it's peaceful, lights are low, baths running, everything's calm. And labor does tend to go rather quickly when they're in that environment where they feel safe. There's no interruptions. The only people in the building with them are the midwife and the doula. And it makes for a much quicker labor. The hospital births I've had, hours and hours and hours, because they don't have that safety. And exactly what you were saying, Sharon, everything faces the door. And every nurse and, they come in, what do you want for lunch? And there's just constant interruption. Even the cleaners coming in to do the bathroom while this mom's in labor. And it's just not conducive to that natural oxytocin. Definitely something we need to promote more of. And that isn't, and it would be, in an ideal world, we'd get it into all the hospitals, is that low light, calm environment. The only people in the room are the birthing mom, partner, doula, midwife, or obstetrician. But that calm place where a mom feels safe. If you look at nature, animals go and find the most secluded place that is surrounded with bush, so nobody's looking in on them. The predators can't find them. They find the most secluded place so that they feel safe to give birth. And if there's a disturbance, labor stops immediately and that mom moves on. And I think being animals ourselves, we have the same reaction. And so 100% labor stalls completely when there are interruptions in the hospital space.
So many moms, that I have encountered, especially working in private practice, they think that it is safer to birth with a gynecologist or obstetrician in a hospital. Like for them, they only see the midwife as, oh no, that's for these crunchy moms who only want to give birth at home. And I even had an encounter with a client. We were waiting for her to go into theatre for a repeat cesarean, and I bumped into the midwife who had delivered 2 of my children, and my client said to me, she said, a midwife can deliver in a hospital? And
sure.
I said, yes, they can deliver anywhere. And and it was like this whole new concept to her. She never imagined that, that a midwife and a hospital would come together to have a different kind of birth experience. So Sharon, how do we change that narrative of it's safer to birth in a hospital with it?
I have to blame the Google machine for this, because in the past, a woman, when she was researching, would read books about topics like what is a midwife. That she would read stories from other women about their births and how they birthed their baby. A woman should, in an ideal world, be told about birth by her mother. But unfortunately, this generation's mothers were very often directed towards the theatre for childbirth. And if you look now at the stats in South Africa, we have the second highest cesarean section rate in the world, which means that this generation is going to be telling their daughters, 80% of them are going to be telling their daughters that when you're pregnant, you go and make an appointment to see a doctor and he'll give you the date that he's going to cut the child out of your body. And that's what we've reduced childbirth to. But if we can see those women who grew up at their mum's knee and she told them while she was playing with her dollies, putting her baby to bed, wiping her dolly, that this is how you were born, and this is how I used to put you to bed, and this is how blah, blah, blah. And if that was your research, then you were given the confidence growing up that childbirth is a normal physiological function that a female body is designed for, and that babies are designed to be born. And if you're going to research that fact accurately with articles that have references and bibliographies, that kind of research will show you that the midwifery model of care is the safest in the world, because a midwife is not only going to guide you through your pregnancy, but she is the one who's going to sit at your side or be on the floor at your side and rub your back and tell you what's happening next and move your leg like this and squat over here like this and eat this and drink that and smell this and go for a walk in the garden and go and have a picnic and have you baked a cake. And what about baking your baby's birthday cake? And why are we not looking at this as a birthday celebration? And if we're all singing and dancing and having a lovely time, then you're producing oxytocin, you're producing endorphins, you've got a celebratory mindset, and so you are excited about the baby being born from your body. If you're only going to talk to the Google machine and you're going to talk to your peers, the level of fear now in a woman today is what is going to stop her from birthing her baby. And there is more fear connected with this generation than any other generation gone before. And it doesn't come from total ignorance. It comes from total ignorance. It comes because we don't ask the questions, because we don't have respect for women the way that we should. We don't tell her what to ask when she's talking to her doctor or what to ask when she's talking to her midwife. We don't tell her to go and explore the hospital fully. If she wants to give birth in that hospital, go and look at it. See if they're open to just come in and I'll show you around. In a previous birthing center in Saxonwold, that is what we would encourage people to do. If there's an empty room, come and have a look, come and see what we want you to do. See that we can push the bed over to the corner. You can put your pool here, put your luggage out here. Look, there's a place, it's a terrace for having tables and chairs. You can have your lunch with your partner out here on the terrace. You can go and walk in the garden and then come back and squat and moan and groan and make as much noise as you like. Instead, we're so worried in private hospitals that you're going to make a sound or you're going to disturb somebody next door. Who cares? We don't want to worry about disturbing people. She needs to have the right to throw her head back and howl like the wolf if she wants to, or growl like a bear if she feels like it, because there's a power of the universe coming through her body and she needs to be verbal. So we need to encourage women to just be themselves and do their thing and be powerful women and therefore powerful mothers and are forced to reckon with. And then we'd need to look at how the medical aids control us. And that's a very sad topic.
That's a big one. That's a big one.
So my 15-year-old son asked me such a great question the other day. Lisa and I have been backwards and forwards with all these moms going into labor at the maternity network that I work in, and all of them landed up in emergency cesareans for various different reasons. No, labor wasn't progressing, cephalopelvic disproportion, high blood pressure in the mother. And my son asked me, he said, what do these people live in the jungle, in tribes, what do they do, if they don't have access to cesarean birth? And I said to him,
good question.
99.999% of those women will not need a cesarean birth. They're eating, their pregnancies are, they're eating literal farm to table foods. Their lives revolve around their tribe. They're all looking after each other. There's no stress of I've got to get this kid to school and then soccer's at 3, but I've got to take that kid to tennis at 3. How am I going to do both? And Google is telling me that I shouldn't be eating this in my pregnancy. And so, and just, having, that realization that the less muck we crowd ourselves with is what is going to make our environments and our bodies more conducive for normal deliveries.
Those women in the past were also physically strong. They saw pregnancy as a normal event. Just get on with your normal life, go and pick up the firewood, go and fetch the water, scrub the clothes in the river, beat it against a stone, get on with things, carry the children. They were physically strong. Instead, we have such a negative attitude to pregnancy today that we tell you, don't climb on a chair, don't hang the curtains, don't eat the soft cheese, don't drink the milk, and then we get women into such a lather. What can I do? And if you look at your list of things that you described there, how you're driving this child and you're waiting for this child at the tennis, and we live in such sedentary conditions now. We're going places, we're going such great distances, but we're sitting here and sitting there and waiting here and doing that, and we're not physically strong to give birth. And we need to look at that aspect of pregnancy and see, so what is your intention to make sure that you are physically strong enough to climb this mountain at the end of 9 months, when your tummy is something that you don't recognize about yourself and you're carrying it around 24 hours a day, and you've got the hardest part to do at the end. How do we encourage women to be physically strong?
That's a very good point, and I think it's one that we need to tell our moms more. They need to walk. They need to let gravity work with them. But what I wanted to go back to, what I started saying just now, is your great question about the tribes and these women giving birth so naturally because they just listen to their bodies. But there it comes in where we had our natural midwives and our natural doulas. The women of the tribes used to come together and help that lady birth. The gogos, the grannies, the aunties, they would come and support that woman through labor and birth and beyond. And they helped heal that woman so wholly. She could go through all of this because she had the support of those other women. And I think it's vitally important that women understand that women help women. Women are there to support and encourage, and it's incredible what you can achieve when women are together. And I'm not dismissing fathers, because they are phenomenal and they are there, and very important role, very, very important role. But coming back to the midwife and the doula, since the beginning of time, women have had other women there to help them give birth. And I think it's something we need to carry on and encourage.
And
Hence
if I might encourage, we're looking at all the topics that you have brought up here today. If I might encourage women to look for books such as Immaculate Deception, is going to talk about what women used to do when they were tribal and they were in communities of women, and is going to look at the development of medicine around childbirth through the 20s and the 30s. And if you look also at Misconceptions, which is the story in America of how women would cross their fingers and think they're going to a private hospital to give birth, and therefore everybody has their best interest at heart, and everybody's going to want them to birth a baby vaginally, and how could anybody possibly have any other ulterior motive around their birth? And then they find out, oh no, your blood pressure's not right for in here, you've got to go next door to the obstetric unit, or you know, you're too overweight, or whatever it might be, that suddenly the agenda changes, and they had no idea that that could happen. And we are in danger of going the same way, in that women travel hopefully thinking, I'm just going to have a baby, I'm going to go to this place which is going to be lovely, they've got a nice menu, and then they find out that childbirth is going to come off the rails there. And also, if they were to read Birth, A History by Tina Cassidy, then they would get to know the history of childbirth, and how it started off with women coming together from the village and just being, and then it was a mystery as to how a baby got out of a woman's body, and men were never involved, and it was just held up, oh, you've got a boy, you've got a girl, you know, and that was the only thing that they discovered. And then religion got in the way, and you know, then it, all sorts of things there. But if you're looking also at Birth, A History, she describes the role of the dad and how it has developed, and she explains very nicely how, when it used to be once a VBAC, always a VBAC, and how it then developed into where it came from, and how it doesn't even make sense in the modern world. You know, it was because if you had rickets growing up, or if you were driven over by a cart and a horse, and your pelvis was all broken, then of course you would have to give birth via cesarean section. And so your pelvis is not going to change in time, and so you'd have to have another cesarean section. But now we can see that those are not the modern reasons for women having a cesarean section. And so we need to expand our minds and realize that we don't have the same situation, that just because one child couldn't navigate through a body doesn't mean the next child can't navigate through that same body. And women need to be given the opportunity to be everything that they can be and are.
You know, summing this all up, coming to the end of our podcast, I think what we need to help women with is that they need to ask the questions. Ask the questions. Speak to midwives. Speak to obstetricians. Who do you want to birth with? Because if you choose to birth with an obstetrician, that's fine. That's wonderful. It's your choice. It's your body. So we're not saying, oh my goodness, you're only supposed to go with a midwife and a doula. I think what we really trying to get across here is ask the questions. Be informed, know what your choices are, and make your own choices about your body and your baby. And I think you two can back
up together that's going to work best for you. Yes. Every woman is different. Every family is different. Every team. There's such an availability to the modern woman. but she can't decide because she likes her gynae and he's been her gynae since she was 16. That is not a reason to stick with
Yes.
the doctor. She needs to expand her mind and realize that her needs are different now. When she goes to have her pap smear every so often, that, you know, her needs are different. Her emotional need now is different. And therefore, she might put together a temporary team for childbirth and go back to her gynae for gynae things after she's given
Yes.
birth.
And a lot of women who don't have access to to a midwife, and they only are seeing their gynaes every 4 weeks or so. And, you can't just WhatsApp your gynae at 8 o'clock and, and say, oh, I was thinking about something, can I run this by you? And that's why, your doula and your private midwife are so much more accessible than gynaes. And even if you are going with a gynae, to have someone like a doula to be able to ask those questions. I had a client who after being with her entire pregnancy, she had severe hyperemesis gravidarum. She couldn't keep anything down. The nausea was so severe, and she just had nothing left to vaginally push a baby out. And she said, "Thank you very much for everything you've done for me up to now." And I said, "Why are you saying goodbye to me?" And she said, "Well, I'm going for a Caesar." And I said to her, "A Caesar is still a birth. We can sit down together and discuss your options in that Caesar." And that's what women think. Oh, well, the Caesar, it's a medical procedure, and that's that. The doctor is in charge. And they don't realize that they even have options within that Caesar. I had a beautiful Caesar experience with another mom where, we lifted her head up. She watched her baby emerge from her body, and she was given immediate skin to skin. And then that baby was placed with her immediately afterwards for breastfeeding. It was so different to these other possible scenarios where the baby is whipped away, taken into an incubator while mom is being stitched up, and mom gets this beautifully wrapped, bathed baby hours later.
Yes, and it doesn't have to be all or nothing, and it doesn't have to be black and white. We can make an elective section very beautiful. We go in 2 hours before the surgery. We give her time to do her affirmations, to make her shrine, to make her space, to fill in the paperwork in a relaxed way, without, sign this, sign this, sign this. Let's go, 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 and get her into theatre. We the way that I work is we fill the pool. We have a beautiful environment. We walk her down to the theatre. We collect her baby. She comes back with her baby on her body, or the dad comes back with the baby and gets into the pool with the baby, so the baby can be relieved of the tension of whatever happened that she needed to have that elective section. Clearly the environment within her body was not conducive to the baby either. And so to unravel the baby in the pool with the dad, and to park her trolley beside the pool while she sees her partner and her baby enjoying themselves, and then to get the baby to the breast and to start the rest of their lives as the family that they are. So again, I think it's wrong to just focus on the birth and how are we going to get this baby out of your body. There's the journey of the pregnancy, then there's the journey of the labor, and then there's the journey of the rest of this family's lives together. And yeah,
I love that, Sharon. I love that. I love how you still hold space for those moms and dads and babies after a cesarean section. And I think, there is it's this or that. It's vaginal birth or cesarean. And we can join the two. We can have beautiful experiences in both situations. And I think choosing a midwife and a doula is allowing you to have that incredible birth experience, however baby comes out, whether it's a belly birth or whether it's vaginal. It can still be exquisite and orgasmic, as you put it. It is. That's a very good point. Thank you, Sharon. Yeah.
And informed choice is what it's all about, isn't it? Isn't that why we've got together for this podcast,
Yes.
so that we can inform families about their choices?
And the beautiful journey that you can take with this. It is such an exquisite journey from that moment of conception for the rest of your lives. But that birth can be and is so exquisite, so exquisite. And I think that's why we're all passionate about it, and we want to give moms and dads and families the best start in life. And so I just want to thank you both for joining me today, and I can't wait for our next podcast, which will be up next week, and we're going to be talking about, Danielle, you can take us through the next session.
So we'll be discussing preconception, basically getting yourself ready, asking the questions, is all I have to do to prepare my body for birth to stop my contraception? And just asking those questions and answering and, discovering, what is best for you and your partner to do to lead to that journey leading up to falling pregnant and enabling your body to become the best home that it can be for that little person for the next 9 months. And Lisa and Sharon, it's been an absolute treat to be with you both and to discuss our passions. And I look forward to seeing you both next week.
And Sharon's going to be taking us through a bit of a diet as well, that we can prepare our bodies to fall pregnant and have that beautiful pregnancy. So, ladies, thank you so much. We'll see you again.
Thank you. Bye.
Bye.